Hello and welcome to Medical Dialogues. I am Dr. Bhumika. Here is what I bring to you from the world of medicine. Exposure to long-term air pollution may increase risk for venous blood clots. A large study found that greater exposure to long-term air pollution was linked with increased risk for blood clots that can occur in deep veins, which, if untreated, can block blood flow and cause serious complications and even death. The findings were published in the journal Blood. These findings came from a longitudinal study that included 6,651 US adults who were followed for an average of 17 years between 2000 and 2018. Participants live in or near one of the 6 major metropolitan areas, that is New York, Baltimore, Chicago, Los Angeles, Minneapolis and Winston-Salem, North Carolina. Throughout the study, 248 adults, that is 3.7% of the study sample, developed blood clots in deep veins that required hospital care. The likelihood of this outcome was linked to anywhere from a 39% to a more than twofold increased risk based on long-term exposure to 3 different types of air pollutants. Exposure to air pollution, which can set the stage for inflammation and contribute to blood clotting, has long been associated with cardiovascular and respiratory diseases. This included exposure to tiny air pollution particles equal to or less than 2.5 micrometers, which can be inhaled from a variety of sources. Participants with greater overall exposure of this type of air pollution had a 39% increased association risk for venous thromboembolism compared to people exposed to lower levels. People with increased exposure to oxides of nitrogen and nitrogen dioxide pollutants, most often found from vehicle exhaust, had a respective 121% to 174% increased risk. To reach these findings, researchers analyzed the relationship between patients hospitalized for venous thromboembolism and levels of air pollution collected through extensive bi-weekly community-level monitoring, including samples taken from the homes of the participants. They then compared those with the highest exposure levels, the top 75%, to those with the lowest exposure, that is the bottom 25%. They also conducted multiple analyses to control for variables associated with venous thromboembolism such as age, exposure to tobacco and underlying respiratory and other health conditions. Thank you for watching Medical Dialogue. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.